Now, the Omicron variant of the COVID-19 infection is spreading very rapidly in Japan. For the first time in recent weeks, Japan has recorded well over 50,000 infections across the country, while the capital city, Tokyo, has witnessed almost about 10,000 infections in a day. So the question, of course, is how is Tokyo planning to contain this sharp surge in the number of infections, and what strategies has the capital of the land of the rising sun put in place? Now, to tell us all this and more, I have with me a very special guest, Ms. Yuriko Koike, who is the governor of Tokyo, who is joining us on this broadcast on WION. Governor Koike, thank you very much indeed for taking your time out and joining us on WION.
Thank you very much for inviting me today.
This must be quite a bit of a challenging time, especially for the Tokyo's administration, which is witnessing a very sharp surge in the number of infections. How are you planning to deal with this surge that Tokyo has witnessed in the span of the last 1 week?
Firstly, I'd like to send my deepest condolences to those currently experiencing a difficult time in India. And I understand that a lot of damage has been caused in India due to COVID-19. And in many parts of the world, the Omicron variant is replacing existing strains at a significant rate. The same is true in Tokyo. As many of you know, that Tokyo is a metropolis of 14 million people. Many of our residents have been meticulously taking basic steps to prevent infections, such as wearing masks and washing hands. And we have been able to keep the number of infected people to a minimum through these measures. And we will overcome the threat of the Omicron variant by making the most of the knowledge and experience we have gained through our fight against COVID-19 and taking proactive measures.
But it's not just the infections, because worryingly, even the rate of hospitalization is going up in Tokyo. What measures is your administration taking to deal with the rising hospitalization at this point of time?
And to respond effectively to the Omicron variant, we strengthened the system for provision of healthcare services this month. And we have secured approximately 6,900 beds these days, mainly for those who suffer from severe symptoms. And we are also currently increasing designated hotels for asymptomatic patients or those with mild symptoms. We will expect to secure 11,000 rooms, including national government and government facilities, and plan to increase this number. In many of these facilities, robots are working to support patients.
You know, it's also interesting that you point out that high-tech robots are being used to care for the COVID-19 patients to ensure that the infection does not spread to people who actually are caring for the patients. But on the vaccination front, how successful has the vaccination rollout been in the Tokyo city?
With regard to vaccines, the number of people who have received the first and second vaccine in Japan is comparatively higher than other countries. The number of Tokyo residents over the age of 12 who have received their first vaccination and their second vaccination are both about 85% respectively. And we have already started providing booster shots for frontline medical professionals and elderly people in general ahead of schedule. And we have strongly requested the national government to ensure that we have the necessary amount of vaccines available for all as soon as possible.
And also to curb the infections, are you looking at the possibility of imposing more restrictions in Tokyo City?
You ask about the restrictions, right? Starting last Friday, which is January 21st, priority preventative measures were enacted for Tokyo. We need to return to basics once more, reducing contact between people as much as possible by eliminating high-risk situations like eating and drinking together at night and breaking the chain of infection. Residents are requested to refrain from non-essential outings and businesses to shorten their hours. At the same time, we are encouraging further basic infection control measures such as avoiding crowds, washing hands, wearing masks properly, and proper ventilation.
Now, across the world, we've witnessed protests by citizens where governments have imposed restrictions. People have come out on the streets. They're not very happy with the restrictions that the governments are imposing because of the level of fatigue that is setting in people who are dealing with virus. At this point of time, how are the people in Tokyo reacting to the strict restrictions imposed by your administration?
The requests from the national and local governments are based upon requests for cooperation rather than law. These are not orders, but people are conscious of the risks of COVID-19 and therefore follow those instructions in order to secure themselves, families, and society as a whole. In addition, pre-testing is conducted so that residents worrying about infection can get results promptly, based on the idea of stopping infection, not society.
Now, the pandemic isn't just a health emergency, is it? Lockdowns have also very badly affected the livelihoods of people. So how does Tokyo manage to strike a balance between imposing restrictions, but at the same time, not letting the restrictions affect the economy?
Now, at the same time, we are thinking of linking infection prevention measures to new growth in Tokyo and Japan. For example, we are strongly promoting working from home. Also, we will vastly accelerate digitalization of Tokyo. As a matter of fact, one of the top CEOs of major mobile phone company is Indian. And these efforts will not only contribute to the prevention of the spread of COVID-19, but will also serve as a foundation that support the new growth of Tokyo and Japan.
Now, Governor Koike, thank you very much indeed for speaking to us and also telling us about the strategies that have been employed in Tokyo. It's been a pleasure speaking with you. Thank you.
Thank you. Bye-bye.